Okay. Well, yeah, Jumano after Saka ne ha nkrata no ohyase se obehwe se obetumi aye adwuma ewo abai mu se oduyefo or apply na nyemre de enso na nya din bebre na de ono no onim ni se wo ha na wo ho modin se wo pese wo ye bibi na otimi ye na unsa ka abodin nkrata ahodo a wo hia se wo de pa adwuma se de tie bia nyame adoma obafam. Dr. Fem.
Okay, things have not been that very easy, but at that time, I succeeded in obtaining the consultancy. And after me, quite a few have had the opportunity, which means things are not very easy, but they are possible. The important thing is that whoever is around should learn very well what they want to do and do it to the best of their possibility.
Ebra onya nkrata na obo modin se odibeye adwuma ewa abai mu no anyemre batekwan ba ho ma otumi yoy na de ewo mu ni se enyemre se obetumi aye na sa fi se onu nya aye na chi no enipa entimi nya asa akwanya ne kakra bi but de onu so ogidie ni se ade a wusua no sua se otumi sua ne ye na otumi prove say yes. Well,
from my point of view also, we have to be very confident and realize that we are second to nobody. When you have worked hard and obtained your qualification, you are absolutely qualified in this society as you would be qualified back at home. The difference is just that here, you are in a foreign land, and back at home, things change a lot. So what is happening?
I think, Doctor, yours is okay, except
yes, there's some connection somewhere which is not working. In any case, let me go on for the moment. So I went into, okay, here I am. I went into activity and opened my own private office. And well, I've worked for government and for private institutions, where in Brescia, I was the chief medical officer in a surgical unit for about 4 years. That is because the gentleman who was the proprietor of that office appreciated my capacity, my ability to do my job. And when you are able to, please always remember that you are absolutely second to nobody. Not everybody will appreciate that, but you must always remember that we are in a foreign country, and you are a human being equal to every other person with whom you have to deal. Are you getting me? Hello?
Hello, Doctor.
Yes, are you getting me?
Yes, we are waiting for our interpreter.
Okay.
Hello, Pastor. Hello, Pastor.
At least we can continue.
Hello, Pastor.
Oh, me pacho, I just say obiye because drew 100 no meaning say be sha si ajame. And internet this will beat me from bontia beka ho. I just say mo am wo ha no obiye translation no. Enye sa phone to me.
I think say Pastor Frank was so many now baby back into mami. Okay. Sir, oni so diane eda prekutu aso e.
Okay, sir, you can continue. Also, the other German. Okay, sir, you can continue.
Okay. So at this point, I think perhaps we could go straight to my topic, which is eye diseases, if you don't mind.
And to say no, person say na brabo mu nsema na oka no afi o person oto aso na abuta ntia obae no odi amai. Okay.
Mebacha Eda, we try say pastor no person mo baso nti ye nhwe eso na ye mana ye nti the best no wa hold on be
Okay, please, you can hold on for some minutes.
Okay.
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 I am trying. We are trying to expand the.
Yes, in fact, I just got the script here that the capacity is full. So I don't know how you're going to do it, but it would mean that you have the opportunity to expand the capacity.
Yes, we are trying to do it.
Okay.
Sister Selina Ipacho, my nyumba kwai.
Okay.
Okay, YouTube link.
Yeah, the YouTube link in also to so.
Yes, I have seen a YouTube link
Yes.
notice.
Okay. Yeah.
No, not to 19. Okay, what things is it? Fair enough. Body of them near highly. Body one.
You are mute yourself, sister. Okay.
Okay. And then not to 19. So what things is it? Fair enough. Now you have to come near highly. Body one. Samfu bena, watanu shayending, avire chichise, mufadin kransemo, ehuntu payentu, wonungkum siupaina.
Okay, Sarina Yadasu.
Amen.
Yadasu Panya Mishra. Okay, I'm saying the info is back. So, doctor, you can continue.
Okay.
Sorry, doctor. We had a technical problem.
No, I mean, those are things that happen. You know, when you're alive, it's easy to have, especially in this technological era.
Yeah.
Yes.
It's sad that we have.
Pastor, you are mute.
Okay.
It's sad that we had an uncertain blackout, the type we used to have in Africa. We have
No, don't worry.
No problem.
We are amongst us. We are amongst us, Mr. Pastor. So that is no problem for me.
Okay.
I hope it won't be any problem for you.
No. And our technician has expanded the platform, so we can go beyond 100 now.
Okay. As before we went offline, I was saying that after I had the citizenship, I immediately applied for consultancy. And in a year or two, I had my application granted. I don't want to say it's easy.
I'll say, Bra, Nansa Khan and Krata, no, or shall say, and I do decay and say, if you a friend, consultancy, and I said, any person me ban ho, ever jay a panchre. Na, a bear fian and female, and I feel, or yes, or for a bamu, na wakayama, and I'm ready.
Okay. I have since worked as a government consultant and in private institutions, and I have a personal office. In one of these institutions, a surgical unit in Brescia, I rose up to the chief medical officer before I left. And it was all based on capacity, activity, and empathy. So we have to remember that we are out of home, but we are equal to every other person, and your ability is yours. Nobody can take it away from you. That is very important, especially to our youth. They shouldn't bow down to anybody. They shouldn't go at loggerheads. There's no fighting anywhere. All they have to do is be confident and do their best, and they can always succeed. It's hard, but it's hard everywhere, even back at home. If you look at my story, I went to Cameroon and I was rejected. It sounded extremely impossible to Italians when I told them that I had to come back here.
Okay. And what you know, Onya, Pine Quayajma, Ewo, Abai, Ayar Sabia, or no one Casanso, or no ne office, and ne, and Yahudua or Yajma. In fact, when ya, the ever cancer promotion, Quenua could do sropa. Now, Passa or cow will weigh who say, and yambre or baby, so the good I be see when it's what, and yambre. Now, a year at my day in CEO, and Afi Akmapa, Abadaye. Albania ewe jumanum. E womsa ha nye ye kromo de. Nanso so nipa bia ye nipa nyina abo nso so esombo. Nti ba bia ye adwuma bia na se de akoma ne abadaye eye adwuma. Na opese ode isa nkwanhye semimma embabun no. Se ye bo sai bi si ani so na yetimi sua duru ho ye ni yi a. Akwanside bebre wo ho de. Nanso so nimde de dia esubaba mfaso na ne ebesua nso no obi antime nyimfiri ensem afen nso so yemma obi nhurunhuran se ye nipa tuntum ana se ye free abibimamu nti dabi yem hunu se ye nipa ye betumi ama ye so aba mfaso ba biara ye wobia.
Okay, just a by story. When I was about to graduate, to me, it was like waking up from a nightmare. I had absolutely no idea of what I would do after graduation. A friend of mine, an Italian, asked me to come with him into ophthalmology. Frankly speaking, that was the last thing I had ever thought of. Today, I can say that it was a blessing. God has his ways for everybody. And it's a surgical specialization practically, but it concerns the whole body. I will, after this by story, start to talk to you about the eye, the way we see or how we see, and then touch a few general topics of diseases. I call this meet the community, which means, according to me, I shouldn't present an academic talk to the community, but give the community the opportunity to ask questions. And on answering those questions, I can then elaborate in such a way that everyone would some sort of understand what I'm talking about without necessarily being a medical doctor, let alone a specialist in eye diseases.
Okay, thank you. Doctor say, okoye jumano, said the wadi kakano, na enyemre, na ebra wo ye mana body and as wo be school no krepa na it said the wada no aso dae na wanyane. Na woni ni a wo beye no nimdie bia. Na nso so na yonko bi eboa no na fe wo ye se wonwura omenye adwuma wo nipadia na akwae ahodo no emu owura mu na ebra wo ye nipadia na akwae no titru ani fm emsa nyame adum ekoso na ne ono otaye ne se wo hyiase no obeka bibi a kyerɛ ya ya na wo mpese wo kasa se wo kasa kyerɛ ne mfɛfo dokutafo enko a lemom o frɛ ne se me ne me mantamfo no anampotamfo no ehia enti de bɛyɛ na me nsɛm no emunye dumro wo no so no me ka bibi kakra bi na ma bie kwan no na ne ha wo mo no o mo bisa me na so o mo bisa me ne ma ha wo mo a eno de ma menya akwanya eka de wo mo hia no kyerɛ wo mo enti sɛ bɛyɛ a me kasa mbro wo mo so no me ma wo mo kwan ma me hu wo mo hia. Thank you, Lord.
Okay. Well, the eye may look very, very small, but it's a very, very, very important organ. It begins to form on the 25th day of pregnancy.
Say o ka ani ho asem na ani no ye ka ani a wo hunu se eyade ketewa bi nanso so ye ka ne padua kwa no ne a ekon no so a na eso a eka ho bi na ye ani no se oba nyinsen oba fa afura ebe se na otwemiensa ekoboso mentem no na ye ani ahyase eba anase eform.
Okay, very important to note is that the eye is it's a proposal of the brain. It belongs practically to the brain, and that is why we generally say you look with the eye, but you see with your brain. People think that you see with the eyes. The eyes are just the camera, the photo camera that captures the image and sends it to the brain through the optic nerve.
Ye ni no sade wo kan won hyeda ne no ho na ya adwene no mpo na ye nsusuyem edi ma ani no eba na ye ni na ewo ho no eka adwene no ho enti wo hwe a adwene no na ehwe bibi na emom bibi a friend say optic nerve di ade a efamu na fe ni ani no hu no asa famu de ade ehunu ye no ho amane akọ no nti ani no eya adwene no fa bi a ode hwe ade efa te se wo hwe ade wo camera mu no efa ani no mu.
The whole process begins with the tears, which a lot of people may think are a waste, but the tears are extremely important in the economy of sight.
Ye ka ani a na hyase no ekogina bibia friend say nisuo we abaka say nisuo de emfaso bia niso nanso so nisuo a eba no say ye kan ni dia edimu tintimbai pa.
In fact, the tears form the first lens. The second lens is the cornea, which is the transparent membrane in front of the eye, which everyone sees.
Yewo anina yewo mu entichemu bebre yedi kan na ye lens no na o se eno na nisuo no edikan eform so mam kan sa eform afa wo wi a yewo bibia friend say cornea no na o se wo hwe anina uhuru no na eno na etoso mi mpacho obi abaso me so a o meet no mpamcho.
Behind the cornea, there is a space we call the anterior chamber, which is filled with fluid, and the fluid is between the cornea and the iris, which is the membrane that gives the eye its color. We have brown eyes because our irides have a lot of melanin. In the center of the iris is the pupil, which is the main.
Doc, here, please. Let us take them one by one.
By one, okay,
yes.
Okay. The anterior chamber.
Please, yeah, the anterior chamber. Or say, baby, or can cornea na chino. You will be a friend say anterior chamber. A hona, young can say ensubi ejina. Yeah, Doc.
Okay.
You can proceed.
Yes. Behind the iris, we have the crystalline lens, which is the main lens of the human eye, or of the the human eye. Let us put it that way, because every living organism has a lens. We have the crystalline lens, which is behind the iris, and it is kept in place by the ciliary body, which is another membrane of the eye.
And you said the walk on a woman probata bebre. It will be a friend say iris. Na watching so ye wo a dear who draw boy the view ha mean can key. Me I can do na just me dinner son of my kite or person walk. And the Sanchi Munina ewo anino.
Okay, behind the iris, we have the vitreous body, which is the jelly that actually keeps the eye in its shape, which is between the lens and the retina, which is the we can call it the film that captures the images and sends through the optic nerve these images to the brain, and we can see what has been captured by the retina.
Okay. Osi ani no so no ye wo mu enchemu baako eno na boa ema ani ni nya ne color say yen ni eye brown. Afa yesa wo widi ana organ fofora eno so na ma ani no shape. Ena afa wo bibi e friend say retina. Sa retina no ena ye ti say wo twa photo de echi ana echi photo no na afa e de mfoni na akoma adwene no ana say eno ne hunu ade no eno hunu ade no eno na ye friend say retina.
Well, the retina is formed mainly of two, at least the main cells in the retina, the rods and the cones, where the cones in the central part of the retina are those that attend to morphologic vision, as we call it. That is, I see you at the moment because my central part of the retina, which is called the fovea, has cones which are functioning. The rest of the eye, which is about 5-6 times the fovea, is inhabited by cones which get the light that lights up the images that the central part of the retina captures and sends to the brain.
Ani no so ehwe ade no so honso ye mu nchemu mienu baako ena ehunu ade no se de ade no tie na baako nso na ma ade na wo hu no emu bai na emu da ho na etume de anubisem no ekoma adwene no.
From this summary description, you can understand that the journey is a long journey and can get disrupted at several positions on its way.
It is a wo hwa Eni no enye sɛ adeɛ baako pɛ bi na etua hɔ. Ɔhun sɛ process na montuo no ɛyɛ bebree. Enti ɛkyerɛ sɛ nneɛma a ebetumi asɔre akwanhyia no betumi ayɛ bebree fi sɛ baabi aho ba asɛm a ebetumi anya nsunsuasoɔ ɛwɔ ani no nyinaa so.
Important too are the eyelids, which are appendages, and they serve to protect and feed the eye, because the cornea especially has no vascularization.
Ani no ɛwɔ mu nkyɛmu odika ka iris no ɔsɛ iris no ɛno na ɛma baabi a ani no hyɛ no ɛyɛ ɛma efi sɛ deɛ ɛbɔ ne din sɛ cornea no onni biribi a ebetumi ama ɔno anko a agyina.
Okay, so the various possibilities of getting sick on the eye are so many. Take, for instance, the eyelid. If you have an inflammation on the eyelid, apart from the fact that it will be painful, the possibility of seeing well are reduced. The quality of the image we see is not very good.
Enti sɛ deɛ wɔka no ani no esan sɛ wɔn krabata na nkyɛmu bebree ansa na aka abɔ mu ayɛ ani no nti no sɛ yade ɛbɛ mu a ebetumi afa baabi a yɛmfa no sɛ yɛni ɛna yɛni ntɔn no anaasɛ ala ni yɛ den yɛni ntɔn ana aha baabi twi no yɛni sɛ kɔba sɛ ɛho nya asɛm ɛho ba asɛm a meka ɛnwoma yi no sɛ ɛho ba asɛm a apart from sɛ ɛbɛyɛ oya no ɛbɛba sɛ de wosi hu adeɛ no nso so no ɛso ate ana ɛbɛba fam wontumi hu adeɛ yi.
Okay, the fact that the eye is an external extension of the brain makes it so painful when you have anything wrong with the eye, especially inflammatory or a lesion.
Enti ani no ɛyɛ adwene no ne fa baabi a epie abɔnten. Enti sɛ enya wɔ hawa titiw sɛ kɔba sɛ ayɛ kɛse baabi ayɛ kɛse anaasɛ baabi ɛho ba kam a ɛyɛ ade a ɛha adwene paa yi.
Okay, we see because we fixate an object point, as we call it technically. It means at this point, I'm fixing my attention on the elder to whom I'm talking to have my speech translated. It doesn't mean that my eye is fixed on him. It has slight movements which bring my eye on him and take my eye off him so that I can see what is written behind him. And we call that the depth of vision. I can see him and see the 3 dimensions, so to say, of the position in which he is, because my eye doesn't stay fixed on him. It moves continuously, but being in good shape, I can see him, read what is written behind him, see the picture of the gentleman on his right side, and the painting on his left side.
Ani no na adeɛ ne sɛ ɛboa mi hu adeɛ. Na deɛ nti ama wo hunu deɛ wo hunu no te sɛ sisi wɔ no ka sɛ ohume. Na deɛ ma no hu mi ne sɛ wɔde n'adwene wayɛ n'adwene sɛ ɔpɛ sɛ ohume. Nti wɔde n'adwene no aniwa no agyina me so nti ohume. Nanso sɛ ani no ɛkɔba sɛ ɔhaw bi anim a ntumi nhwɛ adeɛ baako pɛ nko a. Nti de sɛ no bra wo hwɛ me no efisɛ me na wɔkasa kyɛ me na me nso me de ama mo. Ɛbra wo hwɛ me no wɔsa hwɛ baabi a me wei ne me background no ɛsɛ hu nneɛma a ɛwɔ m'akyi nyinaa wotumi kae ɛbrekɔ no a ɛsɛ hu mfonyi a ɛda hɔ nyinaa ɛkyɛ sɛ ani no ɛhwɛ adeɛ na sɛ ayi adwene na sɛ ayi afuro sɛ bɛyɛ a ɛbra wo hwɛ adeɛ baako no wotumi sa hwɛ nneɛma a atwa ne ho ahyia no at the same time.
Okay. If these movements become erratic for one reason or the other, I can go into squinting. That is, one eye will fixate itself on the elder, and the other eye will fixate on something else. In that case, I have double vision, which is a very severe pathologic position. And it is a type of secondary squinting. That is the bent eye, as we can call it. And I will start from here to talk about eye motility in childhood.
Enti eni no etoda na se bibi ana ekamba mu a ebetuma ba se na ni nsese wo ka se wo hwe me no efa baabi behwe me efa foforo nso behwe baabi foforo eba sa na eye wo haw bi a ano eye din enti eno na wo ka ho asemi na wo beka enkwada mfanse ntotofi wanso so eye dan na omukọ sa haw yi.
Okay, the eye is kept in place by a series of muscles, which we call the extraocular muscles. If any of these muscles goes into a weakness or is paralyzed, that eye tends not to look straight ahead because it doesn't receive the same command that the straight eye is receiving. This can happen when a child is born and they are born squinting. Generally, we operate to straighten the eyes so that the child can develop single vision, as we call it.
Ani no ewo ho no ewo niema ekutakuta mu ma ani netimi gina. Se koba se sa niema ekuta ani no ma etimi gina no emu bi eho eba asem a ebeye te se de na ye ka no. Na che se ani no entimi nhwe ade ko ewo ebreko no a ana se ebetimi ayete se sabi o ye krom ye se mehwe me ba bi no. Nti se ye wo abofra na o sa haw no a se duyefo no hwe sebeya ibetimi ama nani na etimi agina na enye se ohwe ade a na ye mienu no miensa da bi obohu nani no betimi ahu ade an se de sitie preko na mom enye se ohu na o se hu mfoni ni o se hu mfoni ohu no preko.
If this position is not taken earlier in the life of a child, the eye which is squinting becomes what we call the lazy eye because it doesn't develop vision.
Se ko base abofra bi wo sa wo hawwe na ya nso anu amfini mofra abremu a ene de na ni no wo de sa no ebenyini na eba sa se de se wonya bi ohunu ade fam ohunu sa.
At 3 years of age, especially here in the Emilia-Romagna, where I am living and where pastor and the elder are living, children are checked at the age of 3 by ophthalmic assistants who are able to play with the child and are capable of understanding whether the eye is seeing and whether the eye is squinting. In case of a positive result, that is the eye is squinting, the children are sent to us for further attention.
Baby a owo no ene sa Emilia Romagna mpotem hayi sa abofra di mfie miensa ye de no ko ema wo mo wo hu nimdie no o mo hwe abofra no na de o mo ye ne se o mo nya abofra no nya nkitahudie te se ase o mo di agro no but esan se no de training wo mo no o mo timi hunu se abofra no nani no agina na eye how bi anim ana se nani no entimi enyina na ewo how se ko ba se wo mo hunu se ani no wo how a o mo de ba wo mo enchen se be ya o mo be ye hu adu.
Okay, if the situation is refractive, that is, the lenses are not coordinated, which leads to a visual defect, which is not a disease, but a state of the system, we can address the situation with glasses.
Se ko ba se abofra nani no enyina na so nye ya de na enso se de se si hunu ade ene bre se de hunu ade na enya sa de o mu beye ne se ye be pe ahweniwa ama no e de ahye se be ya obetimi enam ahweniwa nso obetimi hunu ade.
Sometimes it is necessary to close the better eye to make sure that the eye which has problems can develop sight correctly.
Etoda se wo kwa de omo ye ebi ne se wani no a ohaw enimu no etoda ne anase wunya ohaw a na yakata wani na eye no na kyerɛ sɛ aka deɛ ɛnyɛ no na ade bɛyɛ adwuma sɛ bɛyɛ a w'ani no a ɛnyɛ no a yɛayɛ ho adwuma no anaasɛ yɛhunu na yɛboa wo no ɛbɛtumi ayɛ adwuma yie sɛ no mmienu ɛyɛ adwuma a ahoɔden no kɔgyina deɛ ɛyɛ adwuma no nso sɛ deɛ yɛakata deɛ ɛyɛ no na yɛ sɛ wode deɛ ɛnyɛ no mmom na hwɛ adeɛ sɛ bɛyɛ ɛbɛboa ama deɛ ɔwɔ ɔhaw no ɛbɛtumi ayɛ no ho aduro na afei watumi ahunu adeɛ yi.
Okay, if this is done in good time, generally we pick the children around 3-4 years, they usually develop good sight. If the child is taken on much later, generally the child will have lower vision in one eye, but the child can grow up correctly and do the rest of his life with one eye seeing much better than the other. Though I must emphasize that paired organs, that is the 2 eyes, the 2 hands, the 2 feet, and so on, are not always equal. There's always a dominant organ. That's a thing a lot of people don't know. If you look at the 2 hands, they look equal, but they are not absolutely equal.
Okay. Ɔsi sɛ abɔfra no bɛn fie mmiɛnsa no sɛ bi a wɔanyi bɛn fie nanom ne ade no na sɛ wɔn hwɛ a wɔn tumi bua ebi a n'ani na ɛyɛ adwuma paa no baako aka no ntumi nyɛ adwuma te sɛ ɛno pɛpɛɛpɛ nanso ne nkwa na nyinaa no obetumi de abɔbra ayɛ deɛ ɛsɛ sɛ ɔyɛ na ɛno no na ɔpɛ sɛ osi so dua ɛkyɛ yɛ sɛ nipadua akwa na ɛyɛ mmienu te sɛ nsa ɛnan ɛne ani no uhu sɛ ne nyinaa yɛ adekɔ nanso no kwasɛm ɛwɔ mu ne sɛ nka menka sɛ yesusu yɛ ɛnan no ho baabiara wɔn sɛ ɛnan no baako wɔ ahoɔden ɛkyɛ baako ebi kura baako wakyɛ baako yɛhu sɛ yɛpɛ but nipadua akwa mmienu ne nyinaa yɛ pɛ da.
Okay, the take-home message here is that parents should watch the children very carefully without being obsessed. A newborn child does not fixate, so they have what we call erratic movements. They fixate first the face of the mother with whom they have more contact. Then gradually, they fixate directions where they have strong sounds and strong light from, because that strikes the retina in the central part and gets the child to read, to see that something is coming out of that direction.
Enti we no ne yɛde to yɛ kotokom ne yɛde abɔbra ne yɛde ahwɛ yɛ fie titu yɛ mma no ɛne sɛ yɛwo yɛ mma no a yɛbɛgyina yɛn ani ne yɛhu sɛ ɛte sɛn anaa deɛ ɛdi kan wohu sɛ wowo ba no a abɔfra no titiriw paa ɛma abaatan na bere a wɔnom anaa abɔfra no wɔ hɔ no ɔgyina n'ani de hwɛ wo maame no ɔhwɛ wo paa afei adeɛ baako bi wɔ abɔfra no yi n'ani taa kɔhwɛ ɛyɛ sɛ bi a ɔbɛte dede anaasɛ ɔbɛhu kanea light bi ɛsaa no na afei ɔkɔhwɛ saa nneɛma wei nyinaa no yɛn abaatan no ɛyɛ sɛ yɛhwɛ no.
Okay, let us look at visual defects or the problems that we have with sight.
Generally, yɛbɛka ani sɛ ani no nya wɔ haw a sɛdeɛ sunsunsan so ɛteɛ.
Okay, generally you would hear somebody saying that they are myope, which does not mean that they are losing sight, as a lot of people say. What actually happens is that the eye is so powerful that we have to put on negative lenses to take away that extra power that the eye has. Take, for instance, somebody with 1 diopter of myopia means that if you put a visual point, which is very small, I don't want to give you those academic numbers that don't mean anything. Let us just say at 1 meter, he sees perfectly well. At 1 meter, 1 centimeter, he sees quite all right, but the image is blurred. You understand?
Yeah.
So we have to put that 1 meter, 1 diopter lens to take his focus out of that 1 meter to infinity, which means theoretically he could see at any distance whatsoever.
You will nipa bi wɔ hɔ a yɛka sɛ obi myopia. Ebinum tumi hu adeɛ na ebinum koraa hu adeɛ ɛboro so sɛ kɔba sɛ sɛdeɛ ahoɔden no teɛ no ano ɔden a ɛsɛ sɛ yɛde biribi a ɛbɛtumi adwom ahoɔden no ano sɛ bɛyɛ a ɛbɛyɛ te sɛ normal. Yɛwɔ nipa bi wɔ hɔ a one no se wo de also one person wo de bibi susu dia nanso se de siti ade na kitikiti kra na ti a otimi hu ehu ne yie pa ana se obi wo ha ebe na ewa akira ni nyina no omo ehwe na omo hu se de omo si aboa wo afa.
Another term which is very commonly used is astigmatism. Let us take it this way, which is easier to understand. When you have a 1 diopter myopia, which is not astigmatic, it means that the whole eye has this defect. If you have 1 diopter of astigmatism, a myopic astigmatism, it means that in that in that direction, the eye has this defect, and in the rest of the eye, it is all normal. For instance, if you have a 1 diopter of astigmatism vertical, that is at 90 degrees, the lens put at 90 degrees corrects the defect that is horizontal at 180 degrees, which means from 179 up to 1 degree, from 1 degree to 179 degrees, the eye is perfectly normal. The error a lot of people make is to think that astigmatism is a type of visual defect and the myopia or hyperopia is another type of defect. Astigmatism can be myopic, can be composed, can be simple, or can be mixed, which I will explain later.
The kind of a bribino and say, a nino, ye will never, your how I would walk, said the Obodino, way, you say, way you say, way you say. Now, a bit my basse, the Wusu said, Tiana, a bit me up, I said, a way, and I said, Niniana Cahu, and I said, Niniana Cahu, and I said, Nanso so, a movie or on bet me, I yena, a copasse, a nino, a bio how we have a casse, and yet, Nanso say, I'm fine, say, I didn't know your ha at your watch here. A free bar con equacy or ha at your son and chrono. If one idea ye, that is a cabba coupe. And ciao. See, say, I didn't know have your watch. And I yenya a more ha at your son chrono. I just a cabba coupe. Na, not just en canino, I have perfect. And the Bakua current just said, Yak, the Union, yet my perfect. But we and a Baku penna or how Kakra a woman.
Okay, the other family of eye defects is hyperopia, which we correct with positive lenses.
A far yet drew sway any or more. Only the end there, and yes, I was fem. Nanino said it's one idea I was through. Nanon so na basa nia yede aboa ne se ye hye no ye wa hwehweniwa fodo type wa yede ma no ehye.
Okay, a hyperopic eye actually is a weak eye, and the positive lens we put on the frames seek to give that power which the eye doesn't have to the eye, so that you can see without having to focus. In normal vision, we don't focus in distance, but we focus for near.
So be was or how no ye de ahwehweniwa a ewo sa ahoden anase eduro no na ma no se be ya obehuna de na enye se eje se wo yire no ho ase wo hwe adeto na empen do no anu sade wa akira yen yire ye ho na mum se epen yen ya na ye yire ye ho se ye pese ye gine ye ni ye.
These visual defects are not all completely understood. What we know, however, is that a child growing or a human being growing, the eyes get more mature, and in hyperopia, very often the visual defect reduces. Meanwhile, with the myopia, it is very likely that it will increase. However, nobody should be worried about it as long as the correction with glasses or with contact lenses gives them a unit, what we call 10/10 or 6/6 in the English system of vision, which is the unity vision.
The kind no said the is huna dear and said or how defects na esiba. And ya dear a church more a ye. It is a church more na as a mudobro yen so. Na ye said the kind of fan and our how be a bar and my nino and huna dear ye. And a be on so. Said they see huna dear so and what then na afternoon ye no no. Nyame adaroma omo opan a betimi afa so a ombeboa na afie etimi gina na etimi abo ne bra se de so.
Okay, let us look at external eye infections, what we call conjunctivitis. Conjunctivitis can
say you can be your friends say conjunctivitis and I say yeah where the knee inside the hole the hui. We can say men can say near see or say a home yeah or church room.
The conjunctivitis could be bacterial when it is infective or viral, and rarely it can be fungal. That is the type of mushroom type of conjunctivitis, which is generally caused by contact lens overwear.
Conjunctivitis na chese yadie bia aba ye ni no a ebetumi aba se infection bi a ebia yenya wo virus ana bacteria ana fungi ni nyina no minhu se mesi aka na twi na ekoba se yenya saa ensunsan so no a ena de saa ohaw no ebre na bibia o se chese yenya free yadie emwa bi ho yeah.
We also have aseptic conjunctivitis caused by excessive light. No welders. I know most of our community members are work in firms where they do welding, or at least work with people who do welding. And I think few of us actually go skiing, where you can have actinic conjunctivitis, which is due to the reflection of the excess light on snow. In any case,
conjunctivitis no ye woni fa bi wo ho a ade na na mu odintinka ofon kakrakra ye woni fa bi wo ho a eno so yenya na eno no kwa ye fa so nya ne se ahoodi a kanea a ye di ye adwuma na se ewo ye nche no de pa ye di no so no ya na no odin titu any bibiti se omo ye wedding won so omo ye wedding na dom di ye adwuma no ema kanea na hoodi na eba wo mani so no edoso ana no yeten enti saafo nso ekonya conjunctivitis nefa ana se sa yade no ebi.
Well, the problems with these inflammations are the complications. If you have an infective conjunctivitis, say bacterial conjunctivitis, and you do your cleaning of the eye very well, in 15 days you get well, and the whole thing is over. The reason someone should always see a doctor is to avoid complications which can often occur. That is, if the bacteria, or especially the virus, is very, very powerful, it can cause corneal lesions that are extremely complicated to treat.
How are you no enka ebia sa conjunctivitis na ebia nka etimi die ni no ehoni nka eno abekọ pese danenum ebe 15 ana na otwi mienu na nia ema ehia se yekohu aduyefo ne se saa yade aboa no obi ho a na how ombetimi complications niam ombetimi di aba abeka de omde aba no ho na akoha adwene nti na ehia se yekohu doctor for na fe omo ehwe no so ho asem ekamai okay bibi kan ho a kamebe kan so em se afama ni so kakra me kan.
So my advice especially is to avoid self-medication, because if you make an error in self-medication, doctors will almost always go through and give you the right position at the end of the disease. But sometimes it could be extremely difficult and very painful, if not very, very costly.
There no can say a confess and say a cobasa, not say one far and call doctor for her and Temua. It immediately question once them can be cana. Until they say, now advice I would have to the mind and say, you who's out how more. Yes, sir, you have my why ha, near the Akuma, a dear for no more shamayan. If you said a child and once them can be cana, no young wood man swap. Yes, one sack or chassis if you chili. If you are who will be dream and some of the baby and some of my twas.
Another form of conjunctivitis is the allergic conjunctivitis, which comes with a lot of itching. It is very human to start rubbing the eyes because they are itching, just as we scratch our bodies when we have itching. That is absolutely a thing which has not got to be done at any cost. What you could do, if you have no possibility of getting consulted very rapidly, is to rinse the eyes with running water, cold water. That some sort of causes vasoconstriction and gives you a bit of relief. But absolutely remember that the eyes don't have to be rubbed for any reason.
Bibia Oboha was your allergy. Na ebia oha wanino wanya oha wofu. Osi enom no eho asem ka no kan hyedan nyedin. Na se ba na opese oye ho bibi dia. Eje se wo di nsuo nwunu, nsuo te se obie pipe no. Na wo di ato bo ase di ahoforo wani no kama osi se ebia ebeto. Na saa oha no wo kan. Osi ya na hene pa yi. Buntu bon se tambia na wo onsa ti anasa wo di twi efise ade na nkasa hin nanka ni na wo ho dia nka je da hia se ye twi na mum sa wo ha no na ma ye hu sa de ya ye hu.
Another inflammation of the external teguments or of the anterior segment is the inflammation or the lesion of the cornea, which is very particular because it is extremely painful and the eye is intolerant to light. When you have that type of a situation, it is a real emergency and the patient has to be seen as soon as possible.
Baako a ɛwɔ hɔ nso ɛne deɛ ɔbɔ din sɛ cornea no anterior kyɛ sɛ n'akyi no sɛ ɛkɔba sɛ wonya ɔha wɔ hɔ a ɛyɛ paa na ɛno no nsunsuanso a ma wohu baako no sɛ ntimi ɛhan koraa sɛ kanea koraa wontumi pagya w'ani hwɛ kanea anaasɛ ade bi a ɛyɛ han biara ɛno deɛ ɛba a ɛsɛ sɛ yɛma yɛn ho yɛ ha na yɛde kɔ ma aduafoɔ boaeɛ.
Another part of the eye anterior segment that easily gets inflamed because of an outgrowth, a fibrovascular outgrowth on the nasal part of the cornea is the pterygium. That can get irritated by simple wind. You know, you go out in a windy day, you come back and you have red eyes. In those cases, however, it is still very, very advisable to use cool water if you don't have anti-inflammatory drops, which are indicated especially by an eye specialist.
Ɔse ɛni no ne how baako nso so ɛyɛ ana ɛfa baabi ayɛ inflamed ɛkyɛ sɛ hɔ ayɛ kɛse na ɛno so sunsunsanso a ma yɛdi hu ne sɛ mframa fa w'ani abɔ sɛ ne w'ani na ahyɛ aseɛ na ɛporo nsuo saa afoɔ no nso so no ɛyɛ sɛ ɔmode nsuo nwunu bɛhohoro wɔn ani no kama na afei adwo wɔn anaasɛ wɔn wɔ aduru a wɔn dɔkita atwa wɔn sɛ basa a wɔn mfa nyɛ wɔn apply.
Another very important infection that you can have in the anterior segment is what we call the uveitis or iritis. And this is caused mostly by systemic infections or systemic diseases. And this is very risky because you can lose sight. So if you start having a very painful red eye and difficulty seeing, it is necessary to consult a medical doctor because that could be a uveal infection that has a particular line of treatment.
Yadia esaya ni a obodin sese no. Osi se ebi ba ya kwemu a enya dia esi etantan ho esi de ko ma a doctor for eboy na no no better no hu. Osi eno no na wo ho a wo nse na wani no aye se sebe ase moja adaso aye gon ana wo nse ase moja adaso. Se wo hu sa de na dia ese se wo ben eduyefo nte.
In some of these cases, we even have posts in the anterior segment, in anterior chamber, which is very clear because you see a real line of white deposit in the anterior chamber. That is also a sign of very severe inflammation.
Na no anterior chamber menim se yenye hu omo no hwe a onhu se ensakraye aba ho e kire se eho no enya wo hawo.
Well, a lot of, almost every one of us, the elder citizens, because I'm quite a very elder citizen, have heard or seen people who have cataract. What we don't know, what a lot of people don't know is that the cataract starts forming from that 25th day of pregnancy, because the crystalline lens begins to form from that moment. And if a child is not unfortunate to born with a congenital cataract, when you are of age, that is 50, 60, 70, as I'm almost getting to 70, it is very normal that you have a cataract. In that case, the only solution is surgery, which does not mean immediately you have to undergo surgery. You undergo surgery when the sight falls and cannot be corrected with glasses or with any other secondary means.
Afei eni no fa ene ne how bi a etai enya eye the friends cataract. Na cataract yem se ye nyina ya ta etati bi. Ye hunu se abofra no yaka se ne ma menyem no a ebe se eni bosome na nani na hyase e form. Nti se we nya de se wonya a wonyi no nti cataract na ta ye enipa a omo enfie e kwa animu nti se ono okasa no ono pamcho me also.
Eda also.
Hello, please.
Also.
Okay. Ose cataract me internet na amam science enye. Ose cataract na etayem penfo ono okasa no or ben 70 years. Na saafo no se ekoba se eni no nyine na ehia saa wo hawo no a eno de ne nso ano no mpem bebre eje se ye operation. Na nchese wo ba ya na ye operation. Oh, okay. Cataract na twin ni ete o hu. Okay. Say obetime anya cataract no na wani wo problem wani no na unhunu ade yi. Enye se bikura BBC so but na ani no ama vision say there was hunu ade na ye play enhunu ni yi. Nti wo kwa ena ombehu ade kwa say cataract na ombe sha ase se ebia ombe ma bibia na lens say into media na etwa se ye operation.
Okay, another very common disease in society is glaucoma, which is a disequilibrium of the eye pressure generally. It can either be open angle, as we call it, which means the eye has a decompensation of the pressure that keeps the eyeball the way it is, because the aqueous humor, the water in the anterior segment, goes out of the anterior segment linearly without remaining there for a long time. And generally, we treat that with eye drops. It is extremely important in this case to follow the instructions of the eye doctor and to do the periodic checkups, because the drugs can lose effect, unfortunately.
Afei yewo eni yade bi a friends glaucoma na eno so eba ba bia ese se ensuo no egina no eno so ho etiminya ohawo se obinya glaucoma no a oso mba de ye ne se ye ma wadu a ye be ma wo de aso wani no so na said the duyafo mba ma wa kwankyere no saa na ese wo ye no pepepe anya sa na no so e de nsunsanso foforo eba.
Okay, I beg your clemency to go a bit fast because I'm seeing that time is flying and perhaps there's so much. This is just the first leg of this conversation, and we shall have many more times to talk about this. Now, let us go to the vitreous body, the jelly that keeps the eyeball the way it is. With age too, except for myopes like myself and perhaps the elder, at a certain point, after 50 years, you start having floaters. A lot of people think, sometimes it is true, that the floaters are disease. Absolutely, it is just aging. I want to call it that way, aging, not old age, because we are just...
because we are getting old.
Yes, we are just gradually getting old. We are not old yet. And that is
like my other brother. He's always refusing to grow.
Oh yes, yes. We are just gradually aging, and we are not aged yet. We are not old yet. Anyway, that is a very normal thing, and in that case too, it is important to be seen by especially an eye specialist who can examine that position of the eye to make sure that there are no breaks on the retina. It is not a disease in itself, but it's a sure sign that we have come of a certain age. No, it's difficult to have a child with floaters.
Any yadie from so ewo no de ono no obaka se on kan se yadie na emom wonyini nua nti se ono se de wo kono okọ na nimu a nti se wo nyini a na abasa o de koma aduyefo no na o report a on behwe se be ya o metumi aboa na afi watumi ehunu ade o ka bio se ye nyine no afi bo se ntiatu no ekono na ani no se de esi hunu ade na esesa nhyada nya ya ade na nyini ena ema na basa na ni nyina na etwawie aduyefo proya.
Okay, then we go to the retina, which is the film that catches the images and sends the images to the brain. Yes.
After you call a fire, friends, retina no. Now retina no me de ehuna de na say utwa photo a etwa mfonini no. Ema ohun say asomasi anade we no mahu na de sa information no come akene no. Ehun asem no obeke.
It's a very complicated sector of the eye because it is very delicate. That is where we really have a real manifestation of the brain tissue.
No ho asem o kana eyade a ne kana kana na ehun asem so kana efise adwene no the information yade ba na ana de ekodi ehun ne gina.
Okay, if the cones which are in the central part of the retina are not functioning well, we cannot see, and you don't see colors, you don't recognize people, but you can see light because the rods which are in the external part of the retina continue to function.
So, a retina no ehia or how we are or can once a year. Dear Banner said, in Timin Huna dear. Say a high etohodia, Utumu say a high. Also, what can tell when you crown so light out to me. Aha, Utumu high, but a nino and shed that intimate Huna and fancy to win terms away a black way to way a cocoa way for.
Okay, when the external part of the retina, the rods, are not functioning, when you get into a room or when the night falls, you get practically it's so dark that you can't imagine where you are. That is simply because the rods are not able to capture the little light that is in the environment.
And he said, "Ekobasa light na itimi hu." And he said, "Oko baby a light in your cry, fans oko dan ya kania ni mu a And enough you won't the word to cry if you said. And ka light kakra wo and a light one and ka we no obetumi aboa na light die no no afi de na chese wakasum mu kra.
This part of the eye has what we call terminal circulation. That is, the vessels pass from the artery to the vein. And this is very important because the feeding of this part of the eye is essential to seeing, to being able to perceive anything that is around you. And unfortunately, this is a weak point of this organ because a lot of systemic diseases like diabetes, like hypertension, can easily affect this part of the eye, which is very, very delicate.
Okay. Doc, does it affect it directly or it affects the arteries and the veins?
The arteries and the veins, especially.
Okay. Or say ni no ne fa ba bi wo ho a ono so ogina duane na ogina ho den no e free de e beka na say entini no say de de moje ekọ ana say de de moje eba nti say ekoba say entimi ma na duane ni ya na fe enya wo hawo che say niema circulation niema entimi ni afro sane enma onensa nka de say nensa kana na akoba say enya wo hawo na eno nso so eniema etimedi saa ohaw no ba ebi ti se yade bi ti se diabetes esichiri yade ana se pressure yade a etimi nya nsunsanso wo nia moja ne di mu afusane se enya ohaw a na entimi mfa de se de komana na ma eni na kosa atibia.
One of the unfortunate situations is that with age too, the retina can suffer very easily. We have what we call age-related macular degeneration, which can either be dry or humid. And this is a very, very, very unfortunate situation because we know a lot about it, but we have not got a real cure. We just manage the disease, which is another concept which I didn't dwell on at the beginning. Doctors generally manage a lot of diseases, but we don't cure them. We give you the opportunity to survive with that ailment.
Okay. Say ekobasa o say we nsusu no eni enyini eno na esa akọ nti enyini nipa no dua na enyina na nipa na enyina otumi koduru mpempenso bi a onya eni ehaw na eno de ohaw a ewo mu ni say enhye da ni aduro say ebetumi akio amawade o ho say ye afiro amawade o ho da bi emom de omo ye ni say omo tumi eboa ama pempenso say yes, I am sure you show, but how won't mean through also a more draw the manage Sabaya, the assessor would do any year, over to me the eye, and also so Ninia any.
Okay, this is a very rough outlook of a few elements of eye diseases and pathology, and I would beg your pardon if we could stop here so that I get a few questions, because at 5 o'clock I will have to drive off from the community.
Okay, thank you so much, God. Maybe I will many musa no num pepe me wo bibia sese meko enti me pese me home so ha enti efa ani no hono ne tofa na mabwe enti me pese me de ebre kakra emma na so obi wa asembisa bia na wabisa sebe ya ebre kakra no metumi de acheche mu enti Pastor Frank me dey say madam ana say we yen hye nso so a emma odi obi share ho there.
Okay, thank you so much, Doctor and our interpreter.
Yes, it has really been wonderful.
Yes. In fact, we have called an expert, and that is the talk of an expertise. We know. We are very grateful. Now, let me allow questions. Please.
Yes.
I've seen 2 hands already up. Mame Matodro and okay, and the radio media church. I don't know if the whole church is asking the question.
Pastor, Brother Charles, but
yes, I've seen the hand of Brother Charles. Let me allow Brother Charles for the sake to ask his first question.
Okay, Brother Charles.
But I'm saying, Mr. Doctor, sir, a dear Ben, many, I said, Munadia, na I said, your bo. I said, a bo as so, I know, a mammy who are there, obi. A woman, a chica, independent my tune. This will bear me. This will bear me. Now, the question say, when I tuberculosis from me, operation, or my con. Until I know what in 3 days time, I'm starting experiencing that problem. Until so, the antenna ambassador, bet me at you, Mukakra.
Doc, Mr. Brother Charles is saying that he has blurred vision. He cannot see clearly, especially from afar off. He sees images afar. I mean, he sees them as something black. Unless, he's asking of the cause.
Well,
but before you come here, he said he had an operation. What's it here for the year?
Tuberculosis.
Okay, he had tuberculosis. I think we've heard.
Yes, I've understood. Yes, it is very likely that he has a toxic maculopathy because tuberculosis is treated with drugs that precipitate in the central part of the eye, and in many cases we get to the point in which he is. However, my advice would be for him in any case to consult, because if part of his problem is a question of glasses, an eye specialist, not an optician anyway, an eye specialist will be able to be of help to him. What actually should be done, sometimes it doesn't happen, is that before they are put on treatment, the internist who is taking charge of it will ask for a consultation to the ophthalmologist. And then periodically, he would be sent to the ophthalmologist to examine him to make sure that he doesn't get to that point. That is, he doesn't come out of the tuberculosis and he's then blind. You understand what I mean? The important thing for him, which might be the real reason, is that he should be seen by an ophthalmologist who will either exclude or confirm that he has toxic maculopathy from isoniazid, which is one of the drugs that actually causes this type of a situation. Yes, in fact, he's still coughing.
Doctor say, a bit me about say, what how no? Yadia woka se wunya ye no ene kwan e fa so sae no so nsunsanso na de akuduru sa nanso so ensesen ke basa brenti ni tofa ne se se wokohu obi a wo specialist na oboa wo no hwe se eye no a ene kwan a mbetimi afa so na wo mo atene niam a akọ achewo no kakra. Ante Brother Charles mpacho wo de no ya do besia pastor mpacho next person
Mame mata oduru.
Pastor, me pacho me da se. Me pacho me mame wo 77. Ko ba afi ni na omo si nani. No call hospital omo se glaucoma se man kan ya mfata. Afi so so ka ho bi. Na ye ne a nipa kro etwa no ho ahia no so mo anhwe yi a se yensa ya se bibisa. Nti mpese mbusa doctor say te sa glaucoma ni timi sai. Ana betima ye ne manyina na mebe na otwini France ache me pa kese ma me nwansi na me nwansi ye no me nwansi sa na mani ye me hini te se de bibi ye me se me mani ni kura na me nti so me dwene ho a me nti ase na me busa no se de osika se wani ye wo hini no betima ye drako mani bia na se de be na ha ye na ekobasa menye aduro ewo ha me de kwa akoma me maame no hu na de.
Doc,
yes.
Madam Martha is saying that her mother is 77 years old.
Yes.
And now he's suffering from glaucoma.
Yes.
Now, she wants to know first, that is glaucoma infectious? Can it spread from person to person?
Absolutely no.
Okay, he says he has been experiencing influenza and he had a very severe itching. So he thought maybe it is something hereditary. So he wanted to know. Besides, is there how can you maybe help her, or is there a way that you can get medicine for the mother who is at home?
Well, first of all, glaucoma is not an infectious disease.
Mame mata, I said the can say yadia a friend glaucoma no, and yet yadia a side.
Secondly, she to get drugs from here for her mother, the first thing to do is we have to know exactly the type of glaucoma the mother has, and then the treatment that she is undertaking, because we may not have the same commercial names here, but if we can have the active principle in those drops that she is using, that can easily be found here and bought, or at least prescribed through what they call here
Please, our Kofi or whoever is the host, the technical host, mute everybody for us.
Okay.
There's a noise behind. Thank you.
Behind, yes, exactly. I was just saying that knowing the active principle, we can always get the correspondence here to be sent to Ghana. I have a patient whose elder brother is in Ghana, and periodically we send him drugs for that. However, glaucoma actually affects the visual field. It's extremely complicated, but it actually means that the space of vision of the patient with glaucoma has holes in it. It is not very easy for the patient to realize that there are these holes, but that is actually what happens, except it is another form of glaucoma, which is the acute type, the angle closure glaucoma, which is very painful, and the real treatment for that is surgery. It's rare, but it does happen. I think the glaucoma that most Africans have is the open angle glaucoma, which we treat with eye drops.
Yeah, Pacho, na noche, Pacho, mute way in my way, Pacho.
Yes, Obi Anke said, now, dear, no, on say, yeah, chance after, and you're on the time of praying. See, this argument album one they had me. Antimata, or say, ye can inside, yet also you say, Annie, Obetimania drew. Now, so him say, and to say you come up passing between you drew, there be answer no as so and the yadia glaucoma no chrono, any treatment to crow, any pempensua, a drew, and son no more. Any a draw on the amano, let's say Cobasso moves out when you know, let's say a drono, and no, I've been here crown. On Benya a draw, and then a year you might pro, I'm out to me the apart command. After your glaucoma, so far baby on so and the part that is operation, as I said, or more year. The antimatter, also dear. Passa.
Okay, thank you. Please, who is the technical host? Is it Kwaku Boateng or Kofi?
It's Kwaku Boateng.
Kwaku, please mute everybody.
And also, Pastor, and I have
yes, but I just can't imagine. There's always a noise behind.
Pastor, the oil host is so mute the oil.
Yeah, I'll try to claim it, but it hasn't been possible. I want to claim who so that I can be muting other people. Okay, doctor, I have 6 hands up, so please manage your time.
Yeah.
Okay, regular media church.
Hello.
Hello.
What's a minute? Hello. Yeah, Dr. Mpachawa, so be a dry eye, no, the medicine so. Na no, a becky and I say, Bewa Hosa, consider wa bewu. Let's say bisa.
Doctor, if
yes.
someone has this problem, that dryness,
dry
or
yes.
Is it curable? That's only the first phase of the question.
Yes.
Can you apply eye drop?
Yes.
Or will it be permanent throughout your life?
Okay. Dry eye is a syndrome, actually. it's a series of signs now, that is itching, burning, and so on and so forth. And sometimes the people see badly because, as I said earlier, the tears, which are actually lacking in dry eyes, are the first part of the trip to seeing. Dry eyes are treated with eye drops, with artificial tears. One thing which is often neglected is that the people, if they don't have problems with their urinary tract, should drink a lot of water. They may drink what they call it here, Lambrusco, but it is important for them to drink water. When they are at home, they can rinse the eyes with running water, but remember not to rub the eyes, but to dry up the eyes, just hitting the face with the towel. Unfortunately, it is a permanent, it is a situation that can only grow worse, because as we grow older, the eyes grow drier. You know, I don't know if it's because we cried very much when we were young. That is how the whole thing is. It is very important for the person, if they are going out on a windy day, to put on, if they don't need eyeglasses, to see some form of protection. You know, you can put on sunshades even if there is no sun, because the wind accelerates the drying up of the little tears that may still be present, and they should not watch the phone for long hours or the television for long hours, because the more you keep your eyes wide open, the drier they become. Unfortunately, it is not curable. It is manageable, as I was saying before. We don't cure most diseases. We just manage them.
Okay. Mama, also there no, or say, saying no queer receiver. Nisua or Shasi or Can once say, a swati anase a biniho. And yet made the idea a drone soso, and when you want to oko ha. It made a soso. After so a brown, so it made in so a horror. Yes, I will robo when in other horror, Sevilla, a tembiano, and in sooner any home, a wow, now we are. Or the Torah and we are come now with the na say idea na nkasa de eno so ayeti si onyine no ama nipa nso gusu onyini enti ye nheda tu ase na mom ye manage enti na antamage wonso so wo de no yo so kana tenten na brain team ebubo no tofa
Como church. Oh, stay a radio mayor.
Radio, yes, pastor.
Yes.
Punsua normally it is when you are young for a punsu and a horse. And so I say, man, just sad and walking soon, a punsu, so to say.
Okay, my network also.
I was so.
Okay, Doc.
Yes.
Eva is asking, you say you didn't hear. You didn't mention, I don't know if my term is correct, sea water.
Yes.
I don't know.
Well, yes, there are eye drops made out of seawater, but that is absolutely not very necessary. You know, what is actually necessary is water in the eyes, be it seawater, be it tap water, be it mineral water, whatever water it is necessary. I know the reason they brought up the question of seawater is commercial, especially because the tears taste like salt. So what the people did was, thought was, if we present eye drops and say they are made of seawater, which is salty, the tears are salty, we have a big portion of the market. So it is not the necessity. What is necessary is that the eyes should be wet in one way or the other.
Enya kono ebeka ho na ma no ye bi na ono de ogiri se for commercial say omo ton ade no e ebo omo ade hu dawu se be ya enipa beto ade ehia ne se eni no I we say na as say brebia na ye kwa ema eho efo nti ensuo no enti ensuo no na ehia say ye pipe die o say ye sutine o say the ensuo erense ye ni no a eno eneye na enye say eye pono na enkyene na ewo mu no ena ama omde afa ho ka se apunsuo but enye apunsuo no ankasa pese na mo nsuo bia odika kan nsuo a se obi owo problem se onum nsuo no saa mo se ipadua na ani no so hia se onya nsuo abranyina enti eda che mpato ya wi o pastor.
Okay, I'm losing sight of. Okay,
I'm sorry,
Como SDHH. I'm an quarter next. So Como first.
Go.
Como SDHH. Okay.
Kasa mpacho what be kasa.
Mbata motemenka.
Yetonka.
Okay. Question no, and say doctor kasa roka say say odo sabako kata wedia ba kono enhede ehu papa na enheda anya yare na me pese me hu say o kata na enim aye ble no eduro bi ho ase nya yare ye de eduro bi ho udubegu so a betimi aboa e na second one no so ne say o hwe me hwe phone so sa na phone light na ama ase menin eprunsio edo so pese me buta doctor say no so yare ana
Me pacho ba ko a wo kan ye wo question no de metene no na me ba ko a doctor kan so ma me bra obusa ayi no dry eye no or say ense se wo hwe TV eche nipa kro no ana wo hwe ugina phone so eche if say wo yesa wani no esansa wo how nti wo gina wani na wo hwe ade sa enyansunsa so miwa ensuo no so emma afi owura question na obusa doctor anka said so don't sakata wani ba ko a o say se wo ba wo mo hwe wa wani na e wa ahode no na ya kata ho se be ya de o mo epese enya ahode no so ya adwuma no wo de no be hwa ade nti mpacho sa no kan okay
then his question
yeah a question for now say mpacho obi kai a on kai me
okay
no crowd dika aka say nhwe phone so nche dika aka say ye hwe phone tenten ni television tenten na emwa ani no okay next
eda amani kwaten konenia no amani kwaten
eda pastor
yes
bede mama ameno
yo
pastor
yes
na me pese bibi ka say ani no eduru baabi ai wo baabi eduru a ya mouse space ana
okay
ya me ka no
emu dawo
doctor
yes
if someone has eye problem
yes
do we have a level of which lens or space would be of no use?
Well, yes, that could happen. You know, if the eye problem. Yeah, it could happen that the patient has or the person has cataract, or maybe they have keratoconus, which is a protrusion of the cornea. It doesn't mean in these cases that the spades are not useful, because if the situation is well studied, spades could be useful. Also, if they have a lesion of the retina or of the optic nerve, spades are absolutely fairly often of no use. It all depends on what the problem of the patient or the person is.
Mame Torres, se yadia no ekoye ti se yadia enyen sinsanso wo di obodi no optic optic nerve and answer cornea and answer retina no and not there. Yes, person never to me are correct. They say they mean to me I say would do say ya not to say Jesus a dear phone a bit me I can say baby are way na ya dear honey free the end to me and yes person
Okay, Mame Dora, we are Palmer Church.
Pastor Medase, I'm still a problem. Many, why make coming? A coming a say, so, and I say, my son, a mamma son so, Amia. Family a drogo so near qua, no, my son to swear.
Okay, Doc.
Yes.
He too is having
yes,
problem with the eye.
Yes.
There is always a severe itch. The itching is severe.
Yes.
And when she applies eye drop, and it affects the ear as well. But
Yes.
when she applies eye drop, both the eye and the ear, I mean the pain, they go down.
Yes. It would mean perhaps that she has a neurovestibular syndrome, which can be run with eye drops. In any case, she has a clear diagnosis of what is here, but the eye itching is generally due to something from outside that is irritating the eye, just like I was telling you of the allergic situation. So the most important thing for her, because to lose the eye or the ear, the hearing organ would be extremely unfortunate, is first of all to try to understand through the othologist what actually is happening, and then the decision on the treatment would be clearer and perhaps not only managing but curing the situation.
Mami Dora, once I was say, oh dear, no, a basia, this oko Ubia, also or Sasha, or be or Shason, no more share as soon. If you say, for us, I want to and answer when you know a year. Now, Nehin and dear, Yana a BB to say allergy, a BB a frabontin, a new a frabontin, a new nipediana, in ya, men can say contact pet. Now, Massa Diana Abba, into Diana, so is all the doctor now share, no whom said or how is it here. That's
okay. Yes, Madam Master.
Palmer, Pastor mentioned Palmer.
Yeah, Palmer Church.
Okay, Pastor Medase, Ada, Yadamasi, Doctor, so Yadasi pa. Mpese hunu se doctor, a bit me up, why na, Bambo bi wo kwa yeni no. Ye bit me de abon point. I am ko, umse bi wo kwa age to how never party. But the bi wo kwa ye bit me abon point ya. Yem ko sa wo how. Ye toso mi. The tosumi no you know sebia obi pesa sister was saibons yes so ebia na o mani di agro sister was saibons Verona yes so he way in my wife okay ebia na yemu bi pesa yehuna krom ha de ya na yekoye yepronotale na de yakobe si pesi ehu ono anka sa okwan penso na yebefa so a ibenya ono aboae ena
de personal and yes a program
the I said me yare mani na mpese me hu ono a bibi ti say bi won so ankwala nso a omoda ombe sorry no mo ani ni nyina akata eno nso ti enema me nsa na mato abo
oh is it me let me the kind no doc.
Yes.
That is asking, is there any preventive methods so that we can prevent ourselves from maybe falling into this problem? I mean, how can we prevent the eye without
From getting into diseases.
Getting into this, yeah.
Well, it is extremely complicated. There are actually things that could be done. First of all, as I said earlier, here in Emilia-Romagna, and I think already in the whole of Italy, little children at about the age of 3 are seen by our collaborators who direct the children with.
Doc, you've muted yourself, please.
We can actually, take, for instance, the idea of not rubbing the eyes and of putting on sunshades when we have dry eyes. And the diabetics and the hypertensive patients should regularly do the eye controls that are prescribed by their medical doctors. Those are the very few things that can be done. For instance, the degenerations which are due to age, we can't do anything about that. We can't suicide as little children. So in any case, not very frequent, but as soon as there is some doubt, it is always very useful to talk to somebody who might be or who will be of the branch of, in this case, of the eyes, as I am, or of the heart, as others would be, and so on and so forth. I understand what you mean, but unfortunately, the eye is a very delicate organ because, as I told you, it is an output of the brain. So the delicatness of the brain is the same that you have on the eye, with the difference that the eye is protected by the eyelids, and the brain is protected by the skull, which are bones which are very, very strong. And to get there, you have to work hard to be able to harm the brain. Meanwhile, with the eye, it is enough with the finger to touch, and you are out on trouble.
Thank you. Elder, any one semno, ne kanapa, Dr. Asema Mikayo. Na yentia se, any no, a yagino, a fabia. Yes, we know where you and a back no, na yo bibia. Yede, ye, no, almost a Batonia no akata, itimide a kata. So na you so a wotikon crua, and so a bohom by. Now, unfortunately, a need diana, and yet didn't say a general diana. A bohu by a untumi and come a bibia are not the a palm answer. Ain't he say a per se a boy who by a footwork a crowd bet me diama abo frano a brow sano say ye making sure say ya heno said ye or children female and cycle fina ya heno. A face oh beer who won't be jabrosua a pressure, high blood pressure, and answer we diabetic and I was such a yadia. Esa say I'm not betting me or how a brain in no. As I said, brown, Oko o doctor no more na or moon to me, the omsa at two yadian so. Now, any dear uncle could say, a Benyan Susan, so I need no hasem dear, no crany ekana. The next question, Doc.
Yes.
Yeah, if someone wants to see you or comes to your office, in the first place, is it possible to contact you or to come to you, and where can we locate you?
Well, you have my phone number.
Yes, please.
Well, at least Pastor has my phone number, and you can give it to anybody who wants to contact me personally for consultation. I have my office in Fidenza where I live, but I can always talk to you and advise you on what to do. Not on only phone. Yes, on phone, so that you can have take a decision, or we can together take a decision on how to handle the situation. Unfortunately, the people who are taking me out are already ringing at the doorbell.
Okay.
So I will beg to leave, and we are just postponing this conversation to another period. So those to whom I have not been able to answer should not be angry with me, because unfortunately, when I accepted and agreed on today, I had completely forgotten that I had another appointment booked months earlier. That's why I forgot the whole thing. So I'm very grateful to have met the Ghanaian community, which I am still looking forward to meet on the Zoom in the coming future. And as I said, you people have my phone number. give it to any community member who has who is in need or who just wants to know one thing or the other. They can always call me, and they will be. I mean, I will answer their phone calls, and we'll discuss whatever is happening to them.
Other Frank.
Okay. On behalf of my district and the elders and over 150 gadgets and a whole church, and our gadgets, some of them can carry about 3 or 4 people on each platform. So at least you've spoken to not less than 200 people.
Oh, that's wonderful.
Yeah.
I'm sorry I didn't. I had this other appointment. I would have gone on for hours on end. I mean,
we are very grateful, Doctor. We are very grateful. I think we made appointment partially, so you hear from me.
Yes, obviously.
Yes. Okay. Thank you so much. Thank you. Let's members come and let's give me a wave. Wherever you are, please open your platforms and let's salute Doctor.
Yes.
Thank you, Doctor. Thank you, everybody.
Thank you, Doctor. God bless you.
Absolutely.
Thank you.
A lot. Thank you.
Bye for now.
Bye for now. Yes. Bye for now.
Thank you so much. You and any moment to us, Doctor Pastor, and to us with radio may say any problem. I deal with spiritual eye problem, not the physical one anyway. Muntie. Na noise be an more no. You can't some more back platforms were a bar now. Want me to, and you won't say, you say, maybe I can see, you mistake this up. I'll buy I know me too. I say, you can't say, you can't separate them, and yet, some other. Some of the money now, something from born with the ruin, the most, one buying, and you know, Doctor, no, Massa friend be. Massa say, Minimum Becassa. This is Oba on crack and Cobacasa can claim now what you questions and also Casacoi. After you we know, one maybe a mamma can't be I'm prepared by a name, you know. The Edika Yaman said, Sam Mano, any youth no, you don't Musia, Obey Juma. And the master may yam or buy it. Why, Doctor, so he can come in fear, say, in fear, baby, as I say, a bossa. Or yeah, Juma. This was a specialist. We can't specialize here. Doctor, no, you're quite. Or me go home, specialist in the exams, no, or no sanity. Oh, we're a specialist, and so we're Camerooni. So, indeed, your man in you, no, Mr. Mother, Mamma, no, Papa, no, Mama Yan can say, oh, how you want to be your at least we are not going university. This is a cry, can or more university cry, and we in man 10. And this is a young call baby, na hana dear, Miss Sewada. If you ask your baby out now, here, you remember boy and bish out. And the Magunina, Massa friend be bench, my friend, Mr. Messany Fry, Munina Amumra. The Munina say, it's a one, she says, go say, special eye program there. Mumsa, I'm physical idea here. Monica Cremona did no prefer number.
Pastor Bajo, me any question.
Sophia boy, that's what
And special eye problem.
Your boy, my boy.
Papa, Pastor Bajo, me no. I'm the question is now. By any, I mean, notice, I say, your problem, that. But instead of say, doctor, I think a problem in a program where I'm and gave ya yet here house. And I may say, it's a whole problem when you call doctor now or more. If it's a question, it's nearby, if I personal questions, personal issues. Next year, I make us say, Obi at home, but near me, who say, I say, yet home, I say, Ewa bra, ye inquire doctor.
Into Miss Rama say problem be or uncle because he in tax each one way. If I boy and medical first. One bit me a shay. In this area, I can to be interested here. Abia, or your mayor, or hey, wait me a free movie. Then walk on what me a chance, eh?
Okay, you know be a consultation free in ammonia burn, and yet doctor no answer say, oh, yanya do back. Doctor say, oh, say African new and no question or ye. Doctor or consultation or just say, oh, friend one, or the bow. And this will be what I program. Mr. Munya say, me no, menana casa, down the friend on the whole day. Upon son, I want to make us. We are very, very busy, but say about more business, we are Ubizamia and a normal man of friend. But make us answer more betrothed. So I said, you knew a bank and frank. Who come medical of a marco. Then you are my dear Barco, I made the Adeba compass and mechanics and quasi be away here, pa, Doctor Anakan. Was it brain, not threat? I don't know the Pia Bontin any na brain one casa de uti concrano a catahon. So if you all have to say near pa and Miss Sewa as all ha now when you ya and Tetam Miss Sewada Yapa many meaning ya pretty and ya bring me and she me call ye a doctor operate me 7 minutes. We are ya, ma'am, that me ya, I'm a farm, myself and to me car baby. Ha, yes, you're pretty when near and no, there was me asking me after operation, I would grab back home. So, and anything ya, dear, adding be and the Mr. Mother, we are near how near the Amuka can, no, doctor, Madamina say, Damina say. Because from time to time in your babies are any betche. One says a baby.
Prince was so many Sabia.
What's it?
Prince, what word? Nensa was so many said.
Pacho, me dynamic can hear the pastor D can never in Kana or Musia and dear or I say no. Now me person me say kaka says I will follow I say na say neba university and I say or any tertiary field be nipa ni betimi a contact me because Ghana for na ye boaboa ye ho towe sa de no nti no sa kwanhwefo ni so ayesua de no me ni mo bia sa na bu on so a okokan so unni menti so bu o sa na ba ko university and I say o person ne ba so ko school so a eno so no betimi abehu ye na bibi o ho bia na so yatimi ama o mahu de ko nyina Pacho me da say
you me da say Prince so what bahana o ba no person ko university asem no working o ba no person ko university say o person o nya kwama eko ana say bi o ko no brofo kase mu a say Ghana fo a o mo ha ko no o mo akeka mo abom so o secretary na akasa yi enenti so we Prince number no afre we ni mu na afre me am de be ma em say ni age Ghana fo ni yi o say Cameroon no person oboa Ghana ni so abrante person oboa Mr. Mother, oh, me no ya how our friend me, mamma number no friend papro. E da mun nyina ase. Da mun nyina ase.
Pastor.
Yes.
Pastor Mpacho, doctor ni number no. Ye be dey na yenya.
Ye ka o pastor number.
Me Mpacho mo pastor brother number.
Ah. Any say yempa doctor number no to platform so anya sa dia nti wa wo frɛ ne wo frɛ me a say me hu say Ghana for no me jam ma we doctor man nya adwuma ye frɛ na o mba say wo nya number no pa frɛ me wo frɛ me say SM number ma nya say me person number ma one we be ye no kia kora intimi invite no biem mo pese o pese mo ni yade no phone so
Lady Amana.
What dear, offer me am the Bama, offer me number and the mount, but a platform say, young fan to some. Yes, sir. You
so for me, Pacho. Me wa me mammy ni details wa hasi and a doctor or boy, and who people seen in no one. Met me as a diamond, the amount no one baby, Nina drew.
Soften Pacho. Mama said a soft canam say high Visia, dear. Gentlemen, I are sunny be out platforms to say. And the Yapon, not so he has only soft to be home comma. Now, what friend? Now, or no wife in a home. And yes, as I say, we are with soft and they miss me there be. Until the Yapon, I be no offer brace him, and I come over brace or what. Ye resi benya adiana yesu an ebe hu nani so na de fa wo ho no de ye neskase wo ha so ho ye neskase wo ha sabi ompamjo we akwa bibi nti anti uji se ace ho asem a obetimi abigina aka se me wo ace we si me wo ye nka nti niema ye personal no ye neskase wo platform so ye wie no na wa contact no kukom na wo ne nipa wo ye esisa wo friend na na di nkomo na won nsem no amedadwa bebre pamcho babia sa na ye enti na okọ consultation a ye woni doctor na na se omo ho no kwa no unyina babia nka wo ha timida mo ase
you opening everyone's head was for the good work done that doctor has make it akoda say e be say friend bi
let us first have me what you be e bi abrama
George my that was it. Me Macedon am the amount no.
Nam ka say other doctor say so be say actually.
Doctor they make it akoda na say. You o pe kura you ya me so on say am other was. You once again in fact many age short term na dey fra no to so mabam na efe. From time to time,
especially District B, Oman tribe.
Yeah, platform so there. There is where action is. Your platform say be ABB until there. BB man how. There be because I best several months. No. The money na say afi yes I can. More free land buy in na can quite ye. Serena. Oko. China. Na say now nkoi okenyambo a mo amoba mse asori bia aka ba akọ na eba asori bia aka ba akọ ye bompa ya nyame mpa mu nyina mra afei pani konto ha ma men kama no funra no ezi ya emienu imisemo a untu ya mieni atua untu ya mieni atua da mu nyina se emese they said first that opening key mass were also or regular media check open wait na pompai upon
yes sir
you me say ye kwa yi enti ya fa won sambra mati mame
asa esa mam Selina bi anko pese o ma onyo ba ku
you
kanam ka se radio for na to amaye
yeah em so munya bombe cruising him and then one better amai na say na abaya no yi
ana precious
so pardon mo
there be uban
great only
yes. You